this session started with some introductions. So my name is Kim Balicki. I am the Orlando Innovation Specialist, and I am honored to be moderating this panel with passionate, energetic, mission-driven providers. And I'll turn it over to Dr. Rice-Weber.
Hello, I'm Jared Rice-Weber. I'm a clinical psychologist at the Central Virginia Healthcare System. I'm a co-creator of Transcending Self Therapy, and I'm working on improving care for folks with substance use disorders.
Hello, my name's Billy Rutherford. I'm a psychologist at the Herschel Woody Williams VA in Huntington, West Virginia. I've been working on in vivo exposure using extended reality for veterans with PTSD, and I've recently been a subject matter expert in developing real encounters with Penumbra Health, which Skip Rizzo mentioned in his talk earlier. And I've also been using Amelia virtual care to supplement my work for in vivo exposures within and between sessions.
I think all of you have already heard from me already, but I'm Caitlin Rollins. I am a registered nurse by clinical background. I'm not sure I mentioned that yesterday. And so today I'll be speaking from the perspective of VA Immersive Program Manager. I'm also Deputy Director of Clinical Tech Innovation, but also just from my role as a bedside nurse and growing a program around immersive technology use in the VA.
Caitlin, Heads and Headsets hashtag has been sweeping the nation. Can you give us a little insight? Where did Heads and Headsets come from?
Who did we decide to give credit to for that phrase? I can't even remember. Was it Anne? Was it you? Come up with Heads and Headsets. Susan Kirsch. Dr. Kirsch came up with Heads and Headsets. Wait, so you're Let's Go, and Dr. Kirsch is Heads and Headsets. Our two hashtags. There you go. Origin story.
Perfect. And why is Heads and Headsets important?
Heads and Headsets is important for many reasons. The primary one being that is the absolute best way to understand the potential of this technology in impacting care delivery and impacting training and education, impacting experience. Most people will say, I didn't really understand it until I put my head in a headset and I experienced it firsthand. Whether that's a clinician talking or a patient or a caregiver, that is the best way to be fully immersed, to be fully understanding of that.
Thank you. So we encourage all of you to use the hashtag Heads and Headsets and encourage those who have not tried virtual reality to try it. Best way to experience it. Dr. Rice-Weber, you work in a clinical setting. How is virtual reality beneficial in the way the VA is providing care to veterans?
That's a great question. So I think that right now nationally, and this is not specific to the VA, someone with an opioid use disorder needs 8 treatment episodes to recover on average. That's not in the VA, that's just nationwide. And so I think the VA, in an effort to advance care, is saying, hey, we need to do the best job. We can't follow what other people are doing. We need to be at the forefront in exploring every option. I think virtual reality is one of those, in that it's just another tool. And so very concretely, we're using the virtual reality headsets in residential programs where if a patient has free time, they can go in and learn cognitive behavioral therapy. They can learn how to identify their thoughts, understand those thoughts that plague them. Muhammad Ali said it, and I think this is kind of a key quote, it's not the mountain that you have to climb, it's the pebble in your shoe that causes you the problem. And so what we're doing is we're using these virtual reality headsets for each of these patients to understand what is that pebble in their shoe. We're also using the virtual reality to help them understand what are their values. So these guys are coming in, and ladies are coming in outpatient and residential settings, and they're sitting down and we're saying, you got a month where you don't have to do what you've always done. And just because the past was dark, it doesn't have to be dark anymore. Let's figure out who you want to be. And the virtual reality is geared towards guiding them through that. It supports the lessons that we're trying to teach in the session. And then for some of the folks that are maybe more shy in a group setting, they're able to then go back to their room and sometimes spend 2-3 hours going through these different settings, learning these lessons, talking to therapists, talking to people in recovery. And it's really supporting the work that we're trying to do as therapists. It's extending the therapeutic reach of clinicians. And we just published a journal article last week showing that the patients are loving it and they're finding it very useful in helping them understand themselves and work towards recovery.
Thank you so much. And we heard from the veteran panel yesterday that veterans are asking for it. And so Dr. Reisweber and his team are providing veterans what they need, how they want it. Dr. Rutherford, give us an example of how virtual reality is beneficial for your patients.
Yeah, for my patients, and like a lot of you around the country, I serve a lot of rural veterans that maybe live in areas where it would take tremendous effort and expense to be around some of the everyday trauma-associated triggers that are commonly requested as something that's really causing them barriers to living, adaptive life. So things like as benign in some areas as heavy traffic or a crowded restaurant, or seeing people from different ethnic backgrounds and just diversity in the environment. To be able to replicate those on a frequent enough basis for long enough to have habituation of anxiety to those, it's a real challenge, and we've always had to be creative, which is great. And I think this is the most creative tool that I've sought out to make that happen. And like in Real Encounters, we made a real effort to include as much diversity as we could in some of those scenarios, especially as the intensity ramps up. And I just don't think that's true. I know that's not just true for my region, and I don't have the number off the top of my head, but a substantial portion of our veteran population in the VA across the country actually lives in pretty rural areas. And a lot of times with combat veterans with PTSD, they'll tell you that's by choice, that's kind of by design, but that's not the only place they need to be in to kind of function in our society. So to me, that's a huge benefit. The other benefit that I've experienced personally so far with all the technology I've used is it's so when you get your head in the headset, it's like a dopamine release. So that's very engaging. It makes you very curious. It's very motivating. And that's not, as you've seen, that's not just true for the veteran you're working with, but it's also true for you as a provider. And I think that when both people are more motivated, more engaged in the process, that's only going to further that therapeutic alliance, therapeutic relationship that we know accounts in psychotherapy anyway, accounts for the most change, no matter what theory or intervention you're working from.
That's great. So it's really reinforcing why the veterans continue to choose the VA with your treatments. And Caitlin has been a role model for 2,000 plus employees, along with Ann and Evan. And this really has been an organic frontline employee building up and what our veterans are looking for also. So Caitlin, I'm guessing you have a lot of lessons learned. We would like you to share with the audience and those looking to online and in person, looking to starting a virtual reality program in their area. What are some lessons learned that you could share with them?
There have been many, of course, on this pathway. But I think some of the most important in, being a clinician at the bedside, trying to do something brand new that no one had ever done before, feeling support is key to success. You need to feel supported, whether that's by your local leadership, FISN, national, your colleagues. And so even myself, starting a virtual reality program at the bedside, I was supported by my local nursing leadership. They were very supportive in my endeavor to improve veteran health care. So I think that is a key thing that I've learned over the years, is that clinicians like Billy, like Jared, like all the others within our VHA XR network, we want to support them through VA Immersive so that they get the same experience that I did as a supported bedside nurse, trying to develop something new that was not only engaging me further and allowing me to use my creativity, but also improving the care that I was able to deliver to my patients. So that is a really big key lesson learned, is that you have to support the frontline staff. And we try to do that in many ways, of course. And the other key piece, too, I think, is making sure that whatever that you're trying to do is truly the solution that's needed for the problem that you identified. We don't want to just throw a shiny object at something because it's the brand new shiny object on the shelf. We want to use that shiny object only if it is the most beneficial way of tackling the problem that we identified. And so not only did I use that in my own work and now share that knowledge with others that we work with for our national pilots, site-level consultations, and I know both of the individuals here on the stage with me, and Kim actually, are very engaged with the idea of human-centered design, like really building something that speaks to the end user. So those are two of my many, many lessons learned.
Thank you for that. And we just so appreciate Caitlin and Ann and Evan for the community of practice calls, and all that we can learn from each other has just been a great resource. So Caitlin, you mentioned human-centered design, which brings me into my next question with Dr. Rice-Weber. I met your team yesterday, and it really put into impact for me all that goes into creating virtual reality program, which is what you and your team did. And if you can just tell us a little bit about that. I know you were trying to solve a problem, what that problem was, and what that looks like.
A lot of work, but fun work. And so I do want to piggyback onto what you were saying, Caitlin, too, is that as a provider, a lot of the folks in substance abuse, and I'm sure this applies to other people too, but I've just been working in substance abuse for about 2 decades now. And it's hard. And a lot of the reasons that we're in it is because it hits our families. Probably a lot of the people in this room have family members that have struggled with addiction. And I'm not immune to that either. I have an uncle who died by suicide in large part because of addiction, and a grandfather, a World War II pilot, who struggle with addiction. And the support you get through the Innovation Network, through Ann, through Caitlin, I can send an email to them, or I am, and they're going to send me something back within 10 minutes. Helps you know that you're part of a VA that is working towards solving the problem. And part of that solving the problem is not just you working in a silo or in isolation. It's working and collaborating with all these different people throughout the VA Innovation Network, and then also being connected with our academic affiliates and our business partners. And so I was looking really hard to figure out who can I partner with to leverage the power of VR to help our patients. And then I was connected with Lighthouse XR, who is just been a blessing. And I think part of it, too, is when you're doing something out of passion, not because you're told to, and that's what the Innovation Network does, is it harnesses the passion of the providers, and then a lot of times gets you connected with passionate business collaborators like Lighthouse XR, who they also, and they've shared this, and I won't go too much into it, but had struggle with a family history of substance abuse. The person is now in active recovery, and I'm so proud for that person. But this is a passion piece. This is a piece where I and many other innovators and a lot of our business partners that the VA and Innovation Network connects us with are driven to help address this problem. We love our patients. Substance abuse is hard. But when you can come to work and work with the collaborators in the business community and with our academic affiliates in a place that surrounds you with the Innovation Network support, you feel hopeful every time you go to work that we're going to advance care, and you feel hopeful that 15 years from now, when I retire, the field's going to be that much better, and it's going to be that much better because of the Innovation Network. It's going to be that much better because of the collaboration, and it's going to be that much better because of what we're doing with virtual reality.
I definitely think that passion shines through, and thank you for that. You'll often find that amongst our employees, there's maybe 3% that really chase change. And I think everyone on this panel and in this room chases change. The rest of us run along with change. And then there's a large group that run away from change. And so with that, I'm going to actually ask Caitlin, how do you, for those in the audience that are wanting to start up a program, how do you engage with stakeholders, the ones that are running away from change and say, that's impossible, we can't do that here?
Should I start with heads and headsets? Because I feel like that was like a really good lead-in for that. I think it is, a lot of it is just awareness and understanding of what this technology can do. So we're very grateful to everyone who showed up for this summit, for example, because it allows you to experience firsthand what it's like to be a person with a head and a headset, but also learning from those that have been doing this work, learning directly from our veterans. And I think, the positive communications about how this technology is impacting our veterans, some of the videos that we've shared that'll bring anybody to tears that watches them, sharing information like that, sharing some of the data that we have, the evidence that we've generated through the pilots of Jared. You've got some great data. We've got some great data that's showing up for some of the pilots that Billy's involved with as well. And being able to highlight that to leadership, to other stakeholders, trying to help them to understand how no matter what discipline, no matter what service line, this is the role that you could play in making this available to our patients. And so a lot of that is collaborative in nature too. So we know that in VA Immersive, we collaborate with all kinds of program offices, many that are represented here today, some of which we've actually heard from today. And that's a key piece of it too, and bringing that awareness not just at the national level, but allowing it to also trickle down to the front line, or in many cases, because this has grown from the front line up, starting there and using all the information that we've gathered as frontline staff and from the patients themselves and bringing that up to leadership and saying, look at what we have accomplished, look at what we've been able to do for our patients. We want to do more of this. How do we make this more widespread? And VA Immersive, and I'm sure many of the others that are doing efforts at their local facilities are willing to share the information necessary to get the buy-in that we need from stakeholders at all levels of VA to make this a more widespread solution that is available to any veteran that may need it.
That's beautiful. And I think too with the VA Immersive group in particular, everyone is so willing to share their information. It's not silos. It's everyone really collaborating. And at the foundation of innovation is human-centered design, which is built on empathy. So Dr. Rutherford, tell us, what do your veterans say about virtual reality? The first time that it really maybe connected with you that this is working.
Yeah, a recent example, we were using the Real Encounters. There's a series of scenarios in a grocery store, and each aisle gets a little more progressively stimulating. This veteran had done that for 2 sessions. Then we were switching over to the other one we have right now, which is a diner, and there's 3 settings, low, medium, and high. And as soon as he said, I just want to go straight to the hard one this time, I knew that it was really having an impact with him. And then debriefing afterwards, his comments were, this is so awesome, thank you so much. I would never have even approached going to the door of a place like that. And of course, the goal of this is to improve, as my son says, he's a teenager, IRL. And I guess that means in real life. I guess that's a thing with the young people. So the goal is IRL. And, the conversation after that is, okay, which restaurant can you get to at least one time this week, even though you do live in a rural area and it will take some investment and some time. And, way more eager to go and try that out, way more confident in his ability to do that. So that's just one kind of example like that that's coming to mind right now, that you have that connection. An unrelated experience I had, that was a younger veteran. I had a Vietnam-era veteran in my office, and some of the equipment for a pilot had arrived, so I had boxes everywhere and a clean box over in the corner. That's a really good way to introduce VR. As soon as people see that clean box, they say, oh, what is that? Is that a 3D printer? And I can say, well, no, actually, and tell them what it does. Then that starts that whole conversation. It was kind of like that. And I told him about some exposure work that could be done in virtual reality. And his response was, I don't see why anyone would ever want to do that or go there. It just so happens, we had some conversations about visiting the wall and a traveling wall, and he was involved in some organizations where he was doing some charitable work trying to get a permanent installation in his local area. And I said, well, what if we could go to the wall right now in that headset, and his face lit up? And right there, when it was personally meaningful, emotionally evocative to him, and something that fit with his values, then he was ready to give it a shot. And he's done real encounters, since that time as well.
That's great. And what I'm hearing you say, too, is that you're connecting with your veterans on a different level. I have never once told a provider that I loved them and that I loved what they're doing. And so I think that really speaks volumes, is you're connecting on a more empathetic level with them. So thank you for that. I want everyone to just think on the panel of, if you could hope for a future of virtual reality, what is your hope for the future? And if there are any niche veteran groups that we haven't touched yet that you would like to see virtual reality in?
I've got a bunch of thoughts about that. Ever since I started looking into virtual reality, it's just a thought like every 20 minutes. And so I can't do all of them. But again, my background, my passion has always been reaching rural and underserved populations. So I would like to see continued expansion in those areas to really, as Dr. Rice-Weber said, expand our reach beyond time and distance. Because to me, that's the two biggest barriers I have serving a lot of patients from a lot of rural areas is that distance, that travel, and then our time to be able to invest in getting enough practice in, getting enough sessions in. So being able to make these experiences even more user-friendly, even more amenable to taking them home, running the program there, checking in either through telehealth or sessions to make it more self-guided, is what I would really hope for the future there. And someone mentioned yesterday some ideas about couples and families work. That's also, just happens to be an area I'm in, and I see a lot of couples, one or both partners have PTSD, and I think there are a lot of potential applications there as well, and haven't seen yet a ton of focus on that kind of thing with some of the pilots that we have right now. So I'm excited about that.
I would piggyback on that, as I would say that TST VR is really, I think of it expanding to really fully address that substance abuse niche, because over 20% of our patients that have mental health issues also have substance use disorders. And so, and like at my VA, which I think it does a great job, but we can't hire substance abuse psychologists. They're very hard to find. Turnover rates, not just in the VA, but across the country, are very high in substance abuse clinics. And so we have to look the reality right in the face and have a sober mindset about it and understand that, well, there's some staffing shortages throughout the country, but now we can use that VR and plug it in so they can go take it home with them. We were talking about rural veterans. Right now, the headsets that we have do not require internet, so that you can take it out and it can be accessible to every single one of these veterans. If there's a veteran that is apprehensive about coming into the VA, that they can have a headset that they take home with them or that we mail to them that bridges that gap and says that, mental health treatment doesn't have to be scary. In fact, it can be very empowering, and it can be about not just stopping the symptom, but helping that patient realize that there's a brighter future out there for them, and we can empower them and help them become the best version of themselves. TST and cognitive behavioral therapy, it's not saying that recovery is about simply stopping using. It's about learning to enjoy life without using. For some, it's a philosophical, for some, it's a spiritual shift. But a lot of guys have said to me after they've been treated and come back that I almost felt like I reached an enlightenment, a whole new way of being. And so I think that VR can go into outpatient. It can go, and there's now liver patients that are needing this. There's so many different things in substance abuse where there are some little holes that I think we can fill those cracks. And I think that if we do that and we keep pushing forward, we can be the worldwide leader in substance abuse treatment. And that's what I want to be a part of, and I think a lot of people in substance abuse in the VA want to be a part of.
That's a beautiful goal. Beautiful hope and very obtainable.
It is, I think.
Caitlin.
I kind of want to just have like a other box that I check and then just put all, if I can just add all to that. I think for me, and especially in my current role, what I would like to see in the future is basically anything and everything that we feel it may be beneficial for from both the clinician and from the veteran perspective. So, listening to Billy talk, listening to Jared talk, these ideas that they have, all of the ideas that I listen to from other VA employees, that they bring them to us, we have consultations with them, they bring me all of the wild and crazy ideas for how they could use immersive technology, and what I want to say is yes and, let's do that. If that's what you think would be beneficial, then let's see if we can make it happen. Just yesterday after I spoke, someone came up, and maybe she's in the room, we were talking about how you could use virtual reality technology for exercise to decrease the symptoms or the incidence of kidney disease, I think is what we were talking about, and dialysis. So all of those ideas, that's what I would like to see for the future, is that we are supported enough to allow these wild ideas to be chased. Sometimes they may not work out. We want to start small, but we have to start somewhere. And if there's a potential, then I think we should chase it.
Thank you. So what I'm hearing from these three is sky is the limit.
When I first met Caitlin and Ann, and that was my, whole start into this, I knew nothing. And I just came to them with a question, and I was like, I did not know that people like you existed. In terms of everything was yes. Everything I talked about was, is this possible? Yes, it's possible. And it was literally like, finding Aladdin's cave, and it's a little overwhelming. You just have to kind of calm yourself down. Okay, what's feasible here? And I hope it always stays that way. I hope it's always this, I've never seen anything in my career as a psychologist take off, from idea to, okay, here's some meetings, here's some people doing this, as quickly as that did, and that's what they're all about. Yeah.
Can I just add to that really fast? So I just want to point out, too, that I think it was last week, maybe the week before, I had 2 different meetings. One, Billy joined me on a call with a facility from the West Coast talking about the Penumbra chronic pain and suicide prevention pilot and those in vivo exposure environments. And he said, this changes how I experience being a provider in the VA. It makes me excited about the work that I do. And then that same week, basically the next day, Jared said almost the exact same thing in another phone call. So I just want to point that out. This technology is not only impacting our patients, but it impacts the providers and the other clinicians that are providing care to our patients, and changes their perspective on the work that they do in our organization. So I don't know if either of you want to elaborate on that idea, but I just wanted to point that out.
Yeah, just real quickly. So prior to coming to the federal government, I was at the University of Pennsylvania at a really great research lab working with the creator of CBT, Aaron Beck. And then I came to the VA and I thought, that part's over. But it wasn't. In fact, I find that the VA is one of the most innovative, forward-thinking places you could ever work in. And prove me wrong to any job applicants that are thinking about coming to work to the VA. This is a really forward-thinking place that values good ideas, values people that care about their patients, and it's a very different VA than 15 years ago.
I can't say it much better than that, but I mean, there are so many resources, and it's easier than ever to get connected with other people, that even a small clinic, in West Virginia of all places, can join kind of these exciting, you have to be where I'm from to understand that. It always feels like you're 15 years behind everything, and all of a sudden, we're right where we need to be, with this type of stuff that's being rolled out very quickly. And I thank you for that, and Ann, and all the collaborators I've had out there. And I hope other people get to have that experience in every VA.
It's a great note to end on. And when I was walking up to the stage with Billy and Jared, I said, so what are your barriers? Their number one barrier, they don't have enough hours in the day for all their ideas. So round of applause for our panel here.